G'day folks, Dr. Zoe Mitchell here. Look, I've been a urologist for over 20 years now, and if I had $1 for every bloke who's walked into my clinic asking whether daily masturbation is wrecking his prostate, I'd be retired on the Gold Coast by now. So let's cut through the BS and talk about what's actually happening down there, because this myth that you're somehow damaging yourself needs to die today. Right. Here's what nobody's telling you. 90% of men masturbate regularly, but about 80% of them are walking around with some level of guilt or worry about it. And you know what? That anxiety is doing more damage than the act itself ever could. I'm going to give you the straight facts in the next bit. No medical jargon, no dancing around the subject. Just real talk about your prostate, your health, and what you actually need to know. Now, before we go any further, let me be crystal clear about something. This isn't some theoretical nonsense I've read in a textbook. I've spent 2 decades examining prostates, running PSA tests, and having honest conversations with thousands of Australian men. I've seen everything from 20-year-olds worried they're overdoing it to 70-year-olds wondering if they should stop altogether. And I'm here to tell you that most of what you've heard is complete rubbish. Let's start with the elephant in the room. Your prostate is about the size of a walnut, sits just below your bladder, and wraps around your urethra. It's responsible for producing about 30% of the fluid in your semen. That's its job, simple as that. But here's what makes it interesting. Unlike most glands in your body, your prostate keeps growing throughout your entire life. Slowly. Sure. But it never stops. By the time you're 50, it's bigger than it was at 20. By 70, bigger still. That's just biology, mate. Nothing you can do about it. Now, here's where the masturbation question comes in. Does regular ejaculation affect your prostate? Yes, it does, but not in the way you think. See, your prostate produces fluid constantly. If you're not ejaculating regularly, that fluid just sits there, and sitting fluid in any part of your body can lead to problems. It's like a water tank that never gets used. Eventually, things get stagnant. I had a patient last year, Bruce, 68 years old, came in because he was having trouble urinating, getting up 3-4 times a night. During our chat, turns out he'd stopped all sexual activity about 5 years earlier when his wife passed. Just figured that part of his life was done. His PSA levels were elevated, he had chronic inflammation, and he was miserable. After we ruled out anything serious, I asked him straight up about his situation. He looked shocked that I'd even ask. But here's the thing. I've seen this pattern dozens of times. Men stop being sexually active for whatever reason, and within a few years, they're dealing with prostate issues they never had before. Now, I'm not saying masturbation is some magic cure-all. That's nonsense too. But the research is pretty clear on this. A Harvard study followed nearly 30,000 men for 18 years. Those who ejaculated 21 times or more per month had a 33% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. 33%, folks. That's not insignificant. But let me address what I know you're thinking, because I get this question all the time. What about the blokes who are doing it every day, maybe multiple times a day? Is that too much? Fair question. Here's my answer. It depends entirely on why you're doing it and how it's affecting the rest of your life. I've got another patient, called him Dave in my notes, though that's not his real name, 55. Came in worried sick because he'd been masturbating daily for years and read somewhere it was going to give him prostate cancer. We did all the tests. His prostate was completely healthy. PSA levels normal. No inflammation. Nothing. He'd been torturing himself with guilt for absolutely no reason. The act itself wasn't hurting him at all. The stress and anxiety about it, though, that was affecting his sleep, his relationship with his partner, his quality of life. On the flip side, I've seen blokes where it has become a problem, but not because of the physical act. It's when it becomes compulsive, when it's interfering with relationships, work, daily life. That's not a prostate issue. That's a psychological issue that needs addressing with a different kind of specialist. But the prostate itself? Generally fine. Right. Let's talk about what actually damages your prostate, because this is important. Number 1 is age. Can't avoid it. Sorry. Number 2 is genetics. If your dad or brother had prostate issues, you're more likely to have them too. Number 3 is chronic inflammation, which can be caused by infections, poor diet, lack of exercise, smoking, excessive alcohol. Notice what's not on that list? Masturbation. Here's what happens when your prostate does develop problems. Benign prostatic hyperplasia, or BPH, is when your prostate gets enlarged, happens to about 50% of men by age 60, 90% by age 85. Symptoms include difficulty starting urination, weak stream, feeling like you can't empty your bladder completely, getting up multiple times at night, frustrating as hell, but not cancer, and not caused by how often you're having a tug. Prostatitis is inflammation of the prostate, can be caused by bacterial infection or, more commonly, by chronic pelvic pain syndrome. This one's tricky because we don't always know what causes it, but I can tell you from 20 years of practice, there's no correlation between masturbation frequency and prostatitis rates. None. Prostate cancer is the big one everyone worries about. And here's where the research gets interesting. Multiple studies, not just one or two, have shown that regular ejaculation appears to have a protective effect. The theory is that regular emptying of the prostate prevents buildup of potentially harmful substances and keeps the cells healthy and active. Think of it like exercise for your prostate. Use it or lose it. Now, I know some of you are sitting there thinking, but Dr. Zoe, I've heard other doctors say different things. And you're right. Medicine isn't always black and white, but I'll tell you what I tell all my patients. Show me the research, not anecdotes, not what someone's uncle told them, not some blog post. Actual peer-reviewed studies. And when you look at the actual data, the evidence supports regular ejaculation as part of a healthy lifestyle. Here's what I reckon you should actually be worried about. Sitting too much. Terrible for your prostate and your pelvic floor. Obesity, linked to more aggressive forms of prostate cancer. Smoking increases risk of aggressive prostate cancer significantly. Diet high in red meat and dairy, low in fruits and vegetables. All bad news for your prostate. See where I'm going with this? Let me give you some practical advice. The stuff I tell blokes in my clinic every single day. First, get regular checkups. If you're over 50, you should be getting your PSA checked annually and having a digital rectal exam. I know. Nobody likes it, but 5 minutes of discomfort could save your life. If you have a family history of prostate cancer, start these checks at 45. Second, pay attention to your symptoms. Are you getting up more than twice a night to urinate? Is your stream weaker than it used to be? Do you have pain or discomfort when ejaculating? These are things you need to mention to your doctor. Don't just assume it's normal aging. Third, and this is crucial, stop reading garbage on the internet. The amount of absolute bollocks out there about men's health is staggering. If you have a question, ask a qualified healthcare professional. Not your mate down the pub, not some random website, not social media. Now, let's address the psychological side of things, because this is where a lot of blokes struggle. We've got generations of men who were told masturbation was sinful, dirty, shameful, that it would make you blind, give you hairy palms, all sorts of ridiculous claims. And even though we know that's nonsense now, the shame lingers. I see it in my clinic constantly. Grown men, successful, educated, still carrying guilt from things they were told as teenagers. Here's what I want you to understand. Sexual health is health. Full stop. It's not separate. It's not less important. It's not something to be embarrassed about. Your sexual function is a good indicator of your overall health. Problems with erections, for example, often show up years before heart disease becomes apparent. Your body is all connected, mate. The psychological impact of sexual shame can be devastating. I've seen relationships destroyed, depression, anxiety disorders, all stemming from unhealthy attitudes about normal sexual function. And for what? Because someone 3 generations ago decided sex was too uncomfortable to talk about honestly? Right. Here's my professional opinion after 20 years of doing this work. For most men, regular ejaculation, whether through masturbation or partnered sex, is beneficial for prostate health. The sweet spot, based on the research, seems to be around 20 to 30 times per month. But here's the thing, everyone's different. Some blokes are fine with less, some want more. As long as it's not interfering with your life, relationships, or responsibilities, you're probably fine. What about the blokes who physically can't do it daily because of erectile dysfunction or other issues? Your prostate doesn't care how you ejaculate, just that you do. If ED is an issue, there are treatments. Talk to your doctor. Don't just give up and assume that part of your life is over. For those of you worried about libido dropping as you age, yeah, that's normal to some degree. Testosterone levels decline gradually after age 30. But if you've noticed a sudden or dramatic drop in sexual interest, that's worth investigating. Could be low testosterone, could be medication side effects, could be depression, could be relationship issues. But it's worth finding out. Here's something nobody talks about enough. Prostate health isn't just about cancer prevention, it's about quality of life. An enlarged prostate making you get up 5 times a night? That affects your sleep, your energy, your mood, your work performance. Chronic prostatitis causing pain? That affects everything. These aren't minor issues just because they're not cancer. I had a patient, Frank, 72, came in because his wife made him. He'd been dealing with BPH symptoms for years, just accepted it as part of getting old, getting up every hour at night. Could barely leave the house without knowing where every toilet was. His wife said he'd become withdrawn, cranky, tired, all the time. We got him on medication. His symptoms improved dramatically, and his wife told me 6 months later it was like having her husband back. That's what we're talking about here. Quality of life matters. Let me give you some red flags, symptoms that mean you need to see a doctor right away. Blood in your urine or semen, pain or burning during urination that doesn't go away, inability to urinate at all. Severe pain in your lower back, pelvis, or upper thighs that doesn't have another explanation. Don't muck around with these. Get them checked. Now, I want to address something I've seen in the comment sections of health videos. People worried that they're masturbating too much, and it's going to cause problems. Unless you're doing it so often that you're developing physical injury, chafing, soreness, or it's consuming all your time and energy, you're probably fine. The line between healthy sexual expression and problematic behaviour is usually pretty clear. If you're unsure, ask yourself these questions. Is it interfering with work, relationships, or daily responsibilities? Are you doing it in inappropriate places or situations? Do you feel unable to stop, even when you want to? If yes to these, talk to a therapist who specializes in sexual health. If no, you're probably just normal. Let's talk prevention. What can you actually do to keep your prostate healthy? Exercise regularly. 30 minutes of moderate activity most days. Doesn't have to be fancy. Walking is fine. Maintain a healthy weight. Obesity is linked to worse prostate health outcomes across the board. Eat plenty of fruits and vegetables, especially tomatoes, which contain lycopene. Limit red meat and high-fat dairy. Don't smoke. Limit alcohol. Stay hydrated. Manage stress. All the boring stuff your doctor's been telling you for years, it applies to your prostate too. Some blokes ask about supplements. Saw palmetto, zinc, selenium. All sorts of things are marketed for prostate health. Here's my take. The evidence for most supplements is weak at best. If you're eating a balanced diet, you're probably getting what you need. Before spending money on supplements, spend it on good food and maybe a gym membership. You'll get better results. Now, here's the bit about masturbation versus partnered sex. Physiologically, for your prostate, there's no difference. Ejaculation is ejaculation, but psychologically and emotionally, partnered sex obviously has benefits that masturbation doesn't. Connection, intimacy, relationship, satisfaction. If you're in a relationship and masturbation is replacing rather than supplementing partnered sex, that might be worth examining, not because of your prostate, but because of your relationship. For single blokes or those without regular partners, masturbation is a perfectly healthy part of sexuality. There's no shame in it, no damage from it, and honestly, it's probably doing your prostate some good. The important thing is that your sexuality, however you express it, feels healthy and positive to you. Right, let's wrap this up, because I know I've thrown a lot at you. Bottom line is this. Your prostate is a normal part of your anatomy that needs attention and care just like any other organ. Regular ejaculation appears to be beneficial for prostate health based on current research. Daily masturbation is not going to damage your prostate unless you're being so rough that you're causing physical injury, which would be pretty obvious. What matters more than how often you masturbate is whether you're getting regular medical checkups, paying attention to symptoms, maintaining a healthy lifestyle, and addressing any concerns with qualified professionals rather than stewing in anxiety or shame. I've been doing this work for over 20 years. I've seen thousands of prostates, had thousands of these conversations, and I can tell you with confidence that most of the worry and guilt men carry about this topic is completely unfounded. Your body isn't as fragile as you think. Normal sexual function, including masturbation, is just that. Normal. If you take nothing else from this, take this. Get your prostate checked regularly, pay attention to symptoms, live a healthy lifestyle, and stop feeling guilty about normal biological functions. Your prostate will thank you for it.